Welcome to Podocyte Talk. In today's episode, we're discussing three important studies that broaden our understanding of how to delay kidney disease progression and reduce cardiovascular risks in patients with chronic kidney disease, especially those with diabetes or glomerular diseases. We begin with a randomized controlled trial that examined whether oral calcitriol, the active form of vitamin D, can provide additional kidney protection in patients with immunoglobulin A nephropathy who are already receiving full-dose renin-angiotensin system blockade. This trial enrolled 138 adults who had biopsy-confirmed immunoglobulin A nephropathy and persistent proteinuria despite optimal treatment. Participants were randomized to receive either calcitriol or placebo for 1 year. The results were promising. Patients in the calcitriol group had greater reductions in proteinuria as measured by both the protein-to-creatinine ratio and the albumin-to-creatinine ratio in urine. Although the absolute change in daily protein excretion was not statistically different, those receiving calcitriol experienced a slower decline in kidney function over 12 months. The annual reduction in kidney filtration rate was significantly less in the calcitriol group compared to the placebo group, indicating that active vitamin D therapy may help preserve kidney function in patients with immunoglobulin A nephropathy. Importantly, no major safety issues were reported. We then turned to a large participant-level pooled analysis evaluating the impact of finerenone on morbidity and mortality across a wide range of patients with chronic kidney disease and type 2 diabetes. This analysis combined data from three major clinical trials: Fidelio DKD, Figaro DKD, and FineArts HF, to include nearly 19,000 participants, most of whom had impaired kidney function and elevated albumin in their urine. The results showed that finerenone consistently reduced the risk of cardiovascular death or hospitalization for heart failure. It also lowered the rates of new-onset irregular heart rhythms, major cardiovascular events, and progression of kidney disease. The kidney protective effects were particularly evident in patients who had high levels of albumin in their urine at baseline. These benefits were consistent regardless of a patient's blood sugar control or level of kidney function. Although the treatment was associated with a slightly higher risk of elevated potassium levels, overall serious adverse events were less frequent with finerenone. This analysis strengthens the case for using finerenone in high-risk kidney disease patients to improve both heart and kidney outcomes. Finally, we explore a massive real-world observational study that followed over 600,000 adults with diabetes across two major health systems in the United States. This study aimed to determine the likelihood of progressing to kidney failure versus dying from any cause, depending on a person's baseline level of kidney function. The findings were striking. Among patients with relatively preserved kidney function, those with an estimated filtration rate of 45 or higher, death was more likely to occur than kidney failure. However, once kidney function dropped below 30, the risk of progressing to kidney failure became more dominant. This shift is crucial for clinical decision-making. It tells us that in early stages of kidney disease, we must focus on managing broader health risks, such as cardiovascular disease and infections, because death is more common. But, in more advanced stages, our attention must shift toward preventing or preparing for dialysis and transplantation. The study also found that men, patients from racial and ethnic minority groups, and those with lower socioeconomic status or recent hospitalizations were at higher risk of both kidney failure and death. These real-world data provide essential guidance for targeting interventions and health resources to the right populations at the right time. Together, these three studies showcase the power of combining targeted pharmacologic interventions, like calcitriol and finerenone, with population-level data to guide our clinical strategy. Join us on Podocyte Talk for more evidence-based updates and clinical insights that shape the future of nephrology. Stay tuned and stay informed.